Hi, I'm Dr. Ryan from Gatling Dental, and I'm here today to answer your questions on TMJ.
Dr. Ryan, what is TMJ?
TMJ actually stands for temporomandibular joints. So when people have been told or they think they have TMJ, they have is TMD, temporomandibular disorders.
What treatment works best for TMD?
I'm not sure there's a best treatment for TMD, but in our practice, one of the easiest ways that we have found over time to treat TMD is to start with some sort of splint therapy. And splints, there's a variety of kind of splints. The first type of splint that people can be familiar with is something that you could buy from Target or Walmart, over-the-counter store. You get it from your local drugstore. It looks like a little boil and make your own athletic bite guard. These can be okay, and sometimes we do offer those to our patients, but we have found that patients can start chewing on them more at nighttime and actually aggravate a lot of the TMD symptoms that they may have. Most common type of splint that patients will get from their dentists are made out of hard acrylic, and they're sent to to a laboratory. So the patient would have, you would have models made of your teeth, and most of these splints are made without looking at the system. Most of them are made without looking at how the jaw joint functions. Most of them are looking at just the tooth contact. So they would make a splint to cover just one arch, and it could be the upper arch or the lower arch. And they would then put them together, fabricate a splint, fabricate the splint so it would be made in between here, and it's just a protective covering against any occluding that goes on with your teeth. The problem with that is they're not taking into consideration the system as far as where the jaw joint is. So these can also be fabricated on a machine called an articulator that mimics the jaw pattern, so it has the jaw joints both sides. The dentist would then get records, bite records, to make sure that it's made in the correct position. So this splint could be made that way. So if you're going to your dentist and you're having a splint made, you may want to ask how they're fabricating it. Do they use instrumentation, or do they just leave it up to the lab technician to make it with their hands? So this splint here is called the MAGO, the Maxillary Anterior Guided Orthotic, which is a fancy name for this splint. The place that we learned to do this was called the OBI, Orthodontic Bioaesthetics International, and they just believe in making upper orthotics, and the way that they treat their TMDs, you wear this 24 hours a day, and you come back to the dental office to be seen many, many times and slowly adjust this into the proper bite. So they're looking at getting stable jaw joints and stable muscles on the occlusal plane of this splint, on how this splint hits. Another type of splint that you'll only find in certain study clubs, organizations, so less and less dentists are educated in how to make these. These are called the Tanner splints, or the anatomical splints is getting to be the key word there. And they're made similar to the MAGO, but a little bit smaller, more sleek design. They're made with the idea of maybe replicating or discovering slowly together over time, slowly discovering how your teeth hit together and what feels better in your mouth. So as you slide your teeth across it or hit on it, little tiny adjustments are made to correlate, to make the symptoms maybe disappear or obviously get better would be the goal. One splint that I'd like to talk about today would be the NTI appliance, and this is an unbelievably genius of an appliance. It's pretty simple if you think about it. It's a small little piece of plastic. By the way, you can check this appliance out online. The website is headachehope.com, or you can just Google NTI. And Googling NTI will bring up so much information you'd be busy for hours. But this is just a very simple appliance that fits just right on the edges of your front teeth. And what's the difference between this little appliance and all the other appliances that we have there is that there is no posterior contact. There's no hitting ability of the back teeth to touch together. And what's great about that is it does not allow the masseter muscles and the temporalis muscles. Here I have a little skull here to show you. The NTI appliance does not allow the masseter muscles and the temporalis muscles here to clench at full maximum ability. We could do a little test. It's a fun test you can do yourself. You can just sit here and clench, and you can feel your masseter muscles bulge or your temporalis muscles bulge. And if you put this appliance in, or what I'm going to do here is actually take a pencil, place a pencil in between your teeth, and then clench as hard as you can. you can't feel the intensity level, the ability of the muscle to clench at maximum is not there. So this little appliance takes advantage of that. You have to be careful when you fabricate these. So you want to go to a dentist that does do many of these. There's a lot of parameters that need to be solid in place before you go home with an appliance like this, as you can understand. So, and then there should be a follow-up a visit with these as well for retention and, of course, checking symptoms. So that is the big way that most dentists that treat TMD, that's the best way they start. There is also physical therapy. We refer to physical therapists. Of course, medication is possibly a route that we will take. But usually, from the start, this solves most of the TMD problems.